So my name is Dylan Wentzel. I'm from the University of Kansas School of Medicine. The project that I'll be presenting today and it is a post-operative hip orthosis beneficial following routine arthroscopy of the hip. And this was a retrospective cohort study that we conducted. I'd like to thank all my co-authors that are listed there for all their help completing this project. So to start off, a little background about this. So the treatment of many pathologies of the hip via arthroscopy has continued to gain popularity, especially in the US. But the impact of postoperative hip bracing has not been elucidated in the literature, whether it affects postoperative patient-reported outcomes or reoperation rates. So this was the question we wanted to answer. So the purpose of this is to determine if there is a difference in postoperative patient-reported outcomes or reoperation rates for patients who are braced versus those who are not braced following hip arthroscopy. So for the methods, this was a retrospective review of 194 patients who underwent hip arthroscopy from 2018 to 2021 by 2 orthopedic surgeons. And the majority of procedures in this study were hip labral repair with femoroplasty and acetabuloplasty. And our surgeons set a date of July 1st, 2019. All patients prior to this were immobilized in hip brace, and those after July 1st, 2019 were not braced postoperatively. And then we collected patient-reported outcomes in the form of visual analog pain scale, modified Harris hip, single assessment numeric evaluation, and VR12 physical and mental scores. And we collected these at 2 weeks, 4 weeks, 3 months, 6 months, and 1 year, and then 2 years postoperatively. Additionally, we wanted to stratify these results by gender to assess any gender-based differences. And these were all compared between the two groups, and we set a significance value at 0.05. So in the middle, you can see our graphs of the patient-reported outcome measures. And as you can see, both groups parallel each other relatively well. And we found that there was no significant difference in any of these patient-reported outcomes at any time points post-operatively. We were underpowered for a few of the later time points and hope to expand our study in the future to better power some of those values. So as I said, there were no significant differences in any of the patient-reported outcomes. We also looked at the reoperation rate between the two groups, and that was any reoperation rate that occurred within 2 years of the primary operation. This again, there was no significant difference, found a p-value of 0.208. Also compare the demographics of the two groups, age, gender, and they paralleled each other relatively well. So overall, the findings of this study show that a hip brace does not impact patient-reported outcomes or negatively impact the reoperation rate post-operatively. And with the hip brace, post-operative bracing can increase perioperative costs, and therefore foregoing the use of a brace, patients can also avoid the associated morbidity that comes with wearing a brace for a long period of time. So overall, the results of this project hope to guide clinical decision-making as pertains to whether to use a hip brace post-operatively. And like I said, foregoing the use of this brace can help to reduce perioperative costs and also prevent associated morbidity that comes with wearing this brace. And that is all I have. I'll take any questions if anyone has any.